As a woman over 65, you have the right to receive respectful, thorough, and competent medical care. Unfortunately, not all healthcare providers meet these standards, and some may reveal their inadequate preparation, bias, or even negligent approach through the questions they ask. What you're about to learn could protect you from substandard care and help you identify when it's time to find a healthcare provider who truly respects your intelligence, experience, and health needs. Medical ethicists and geriatric care advocates have identified specific types of questions that serve as red flags, clear warning signs that your healthcare provider may not be approaching your care with the professionalism and competence you deserve. These aren't questions about your symptoms or medical history, which are always appropriate. Instead, these are questions that reveal assumptions, biases, or lack of preparation that could compromise the quality of care you receive. Dr. Catherine McLean, a geriatrician and researcher at UCLA who has studied ageism in healthcare for over 2 decades, explains that the questions healthcare providers ask reveal their attitudes about aging, their assumptions about their patients' capabilities, and their level of preparation for appointments. When doctors ask questions that are inappropriate, disrespectful, or reveal they haven't reviewed your medical records, they're showing you exactly how they approach patient care. This isn't about being overly sensitive or difficult. You've lived 7 decades. You've raised families. You've managed careers and households. And you've navigated countless challenges. You deserve healthcare providers who recognize your experience and intelligence, not ones who treat you as if your age makes you less capable of understanding or participating in your own care. Before we examine these 6 warning signs, it's important to understand that good healthcare providers prepare for appointments, review medical records beforehand, ask relevant questions about your health concerns, and treat you as an equal partner in your care. When providers fail to meet these basic standards, it often shows up in the inappropriate questions they ask. The first type of question that should make you immediately reconsider your healthcare provider is any version of, "How old are you again?" When this information is clearly documented in your medical record and readily available to anyone who bothered to review your chart before the appointment. When healthcare providers ask about basic information that they should already know, it reveals they haven't prepared for your appointment. Dr. Michael Roizen, a physician who has written extensively about age-related healthcare, emphasizes that competent healthcare providers always review patient charts before appointments. When doctors ask about your age, birth date, or other basic demographic information that's in your file, they're essentially telling you that your appointment isn't important enough for them to spend 5 minutes reviewing your information beforehand. This lack of preparation often extends to more serious oversights. If your doctor doesn't know your age without asking, they probably also don't know your medical history, your current medications, your allergies, or your previous test results. This kind of unpreparedness can lead to dangerous medication interactions, inappropriate treatment recommendations, or missed diagnostic opportunities. Geriatric medicine specialists report that prepared healthcare providers walk into appointments already knowing basic patient information and use appointment time to focus on current concerns, new symptoms, and treatment planning. When providers waste appointment time asking about information they should already know, it suggests they're not giving your care the attention it deserves. The second red flag question is any variation of, "Are you sure you can handle this treatment?" or, "Don't you think you're too old for this procedure?" When asked without any medical justification based on your individual health status, these questions reveal age bias and assumptions about what older adults are capable of handling, rather than individualized medical assessment. Bioethicists who study age discrimination in healthcare explain that treatment decisions should be based on your overall health, cognitive function, life expectancy, and personal preferences, not on arbitrary age cutoffs or assumptions about what people your age should want. When healthcare providers suggest you're too old for certain treatments without thoroughly evaluating your individual situation, they're practicing age-based medicine rather than evidence-based medicine. Dr. Linda Terry, a geropsychologist who studies aging and healthcare decision-making, notes that many medical procedures and treatments can be appropriate for people in their 70s, 80s, and even 90s when their overall health and personal goals support these interventions. Healthcare providers who assume older adults can't or shouldn't pursue certain treatments are often operating from outdated or biased perspectives. Appropriate healthcare providers ask about your goals, preferences, and concerns about treatments. They discuss risks and benefits based on your individual health status. They don't make assumptions about what you can handle based solely on your age. If your doctor suggests you're too old for a treatment without thoroughly evaluating your individual situation, it's time to seek a second opinion or find a new provider. The third concerning type of question is, do you live alone? When asked in a way that suggests living independently is inherently problematic, or when followed by unsolicited advice about assisted living or giving up your independence. While living situation can be medically relevant in some contexts, the way this question is asked and followed up reveals the provider's assumptions about aging and independence. Geriatric social workers and elder care advocates explain that living alone is a choice that many older adults make successfully and safely. When healthcare providers ask about living arrangements with a tone that suggests independence is dangerous or inappropriate, they're revealing bias about aging rather than conducting appropriate medical assessment. Appropriate healthcare providers ask about living situations when it's medically relevant. For example, if you're recovering from surgery and need help with daily activities, or if you're having balance issues that might affect home safety. They ask these questions to understand how to support your health goals, not to suggest you should give up your independence. If your healthcare provider asks about your living situation with implications that independence is inappropriate for your age, or if they immediately suggest you should consider assisted living without any medical justification, they're operating from ageist assumptions rather than medical evidence. The fourth warning sign is questions about your mental capacity or memory that are asked without any medical indication or proper assessment tools. Comments like, "Are you sure you remember that correctly?" Or, "Do you think you're still sharp enough to make these decisions?" when you haven't shown any signs of cognitive impairment are inappropriate and disrespectful. Neuropsychologists who specialize in aging and cognition emphasize that cognitive assessment should be done systematically, with validated tools when there are specific medical indications. Casual questions that challenge your memory or decision-making capacity without proper evaluation are unprofessional and potentially harmful. Dr. Jason Karlowish, a geriatrician and bioethicist at the University of Pennsylvania, explains that competent healthcare providers distinguish between normal age-related changes in processing speed and actual cognitive impairment that affects decision-making capacity. When providers question your mental capacity without proper assessment, they're often operating from stereotypes about aging rather than clinical evidence. Appropriate healthcare providers take your self-report seriously, ask follow-up questions when clarification is needed, and conduct formal cognitive assessments only when medically indicated. If your provider questions your memory or decision-making capacity without cause, it's a serious red flag about their approach to geriatric care. The fifth problematic question type involves inappropriate inquiries about your family's opinions or involvement in your medical care, such as, "What do your children think about this?" or "Shouldn't we ask your family before making this decision?" when you haven't indicated you want family involvement or when you're clearly capable of making your own decisions. Medical ethicists who study patient autonomy emphasize that competent adults have the right to make their own health care decisions regardless of age, and healthcare providers should respect patient autonomy unless there are clear indications of impaired decision-making capacity. When providers automatically defer to family members or suggest family input is required for your medical decisions, they're undermining your autonomy. Patient. Advocacy specialists report that many older adults experience unwanted family involvement in their healthcare because providers assume that age requires family decision-making. This assumption not only violates patient autonomy, but can also complicate medical care when family members have different opinions or agendas than the patient. Appropriate healthcare providers ask if you want family members involved in your care and respect your preferences about medical privacy and decision-making. They recognize that you are the primary decision-maker about your health unless you specifically request family involvement or unless there are documented concerns about your decision-making capacity. The sixth and perhaps most concerning type of question involves dismissive responses to your symptoms or concerns, such as, "Isn't that just normal for your age?" Or, "What do you expect at 70?" when you're reporting new or concerning symptoms. This type of response reveals that your healthcare provider is attributing your symptoms to age rather than conducting proper medical evaluation to determine if there are treatable underlying causes. Geriatricians who specialize in evidence-based aging care emphasize that normal aging does not include significant pain, disability, depression, or dramatic changes in function. While some changes occur naturally with aging, many symptoms that providers dismiss as normal for your age are actually the signs of treatable conditions that can significantly improve with proper diagnosis and treatment. Dr. Mary Tinetti, a geriatrician at Yale School of Medicine, who has spent decades studying aging and healthcare, explains that ageism in medicine often manifests as providers attributing symptoms to age, rather than investigating potential causes. This approach, sometimes called therapeutic nihilism, assumes that older adults should expect decline, and that investigating or treating age-related symptoms isn't worthwhile. Research, published in the Journal of the American Geriatrics Society, shows that when healthcare providers dismiss symptoms as normal aging, they often miss treatable conditions like depression, thyroid disorders, vitamin deficiencies, medication side effects, and early-stage diseases that could be managed effectively with proper diagnosis. When your healthcare provider responds to your symptoms with dismissive comments about your age, they're essentially telling you that they don't believe your symptoms deserve investigation. This approach violates basic principles of medical care and can result in misdiagnoses, untreated conditions, and unnecessary suffering. Appropriate healthcare providers take new symptoms seriously, regardless of patient age, conduct thorough evaluations to determine underlying causes, explain which changes might be related to normal aging and which require further investigation, and work with patients to address symptoms that are affecting quality of life, even if they are age-related. Now that we've identified these 6 warning signs, let's discuss what to do if you encounter these problematic approaches and how to find healthcare providers who will treat you with the respect and competence you deserve if you encounter any of these warning signs during a medical appointment. You have several options depending on the severity of the situation. For less serious red flags such as lack of preparation or inappropriate questions, you can address the issue directly by pointing out that the information is in your medical record or by stating clearly that you're capable of making your own healthcare decisions. However, for more serious concerns like age discrimination, dismissive attitudes toward your symptoms, or questioning of your mental capacity without cause, it may be time to find a new healthcare provider. You don't owe anyone an explanation for seeking better care, and you shouldn't feel guilty about prioritizing your health and dignity. When looking for new healthcare providers, geriatric care advocates recommend asking specific questions during initial consultations to assess their approach to senior care. Ask about their experience working with older adults, their philosophy about aging and treatment decisions, and how they typically involve patients in treatment planning. Pay attention to how potential providers respond to these questions. Good geriatric care providers will emphasize individualized care, patient autonomy, and evidence-based decision-making rather than age-based assumptions. They should be comfortable discussing their approach to working with older patients and should demonstrate respect for patient experience and preferences. Look for healthcare providers who are board-certified in geriatric medicine or who have additional training in caring for older adults. While this isn't always necessary, providers with specialized geriatric training are more likely to understand the complexities of aging and to provide age-appropriate care without falling into ageist assumptions. Consider seeking care at practices or medical centers that specialize in geriatric care or that have reputations for providing excellent senior care. These practices often have systems in place to support comprehensive geriatric assessment and are more likely to have providers who understand and respect the needs of older patients. Don't hesitate to interview potential healthcare providers before committing to their care. During initial visits, observe whether they review your medical history beforehand. Ask appropriate questions about your health concerns. Listen to your responses without interrupting. Explain treatments and procedures clearly. Respect your questions and concerns, and treat you as an equal partner in your healthcare decisions. Red flags during initial consultations include providers who seem rushed or distracted. Don't make eye contact or seem dismissive. Ask inappropriate questions about age or mental capacity. Make assumptions about what you can or should do based on your age, or seem uncomfortable when you ask questions about their approach to geriatric care. Building a strong relationship with appropriate healthcare providers requires active participation on your part. Come prepared to appointments with written lists of your concerns and questions. Bring all current medications and supplements. Provide clear, specific information about your symptoms. And don't hesitate to ask for clarification when you don't understand something. Be honest about your health goals and preferences. If maintaining independence is important to you, say so. If you want to pursue aggressive treatment for a condition, make that clear. If you prefer conservative management, communicate that preference. Good healthcare providers want to understand your goals so they can provide care that aligns with your values and preferences. Don't be afraid to advocate for yourself during appointments. If a provider makes dismissive comments about your age or suggests treatments aren't appropriate for someone your age, ask them to explain the medical reasoning behind their recommendations. Request specific information about risks and benefits based on your individual health status, not general assumptions about people your age. If you encounter age discrimination or inappropriate care, consider reporting the incident to relevant medical boards or healthcare facility administrators. While this won't immediately solve your individual situation, it may help prevent other patients from experiencing similar problems. Keep detailed records of your medical care, including notes about appointments, treatment recommendations, and any concerning interactions with healthcare providers. This documentation can be valuable if you need to file complaints or if you need to provide information to new healthcare providers. Consider seeking support from patient advocacy, organizations that specialize in senior healthcare rights. Groups like the National Council on Aging and AARP offer resources and guidance for older adults navigating healthcare challenges, including how to find appropriate providers and how to advocate for respectful care. Remember that age. Discrimination in healthcare is not only unethical, but may also be illegal under various civil rights and disability laws. You have the right to receive medical care that is based on your individual health status and needs, not on stereotypes or assumptions about aging. Building a healthcare team that respects your dignity and provides competent care may take time and effort, but it's essential for maintaining your health and well-being as you age. Don't settle for providers who don't meet professional standards or who treat you disrespectfully because of your age. Look for healthcare providers who demonstrate cultural competency in working with older adults Stay current with evidence-based geriatric care practices. Communicate clearly and respectfully. Involve you in decision-making processes. And coordinate care effectively with other providers when needed. Consider working with geriatric care managers or patient advocates if you're having difficulty finding appropriate care or navigating complex healthcare systems. These professionals specialize in helping older adults access quality healthcare and can provide valuable guidance and support. Don't let one bad experience with a healthcare provider discourage you from seeking the medical care you need. There are many excellent healthcare providers who specialize in geriatric care and who treat older patients with the respect and competence they deserve. Your health and dignity matter at every age. You've earned the right to receive health care that acknowledges your experience, respects your autonomy, and provides competent medical evaluation and treatment. Don't accept less than you deserve simply because of your age. The questions your healthcare providers ask reveal their attitudes, preparation level, and approach to patient care. When providers ask inappropriate questions or make age-based assumptions, they're showing you that they may not be the right fit for your healthcare needs. Trust your instincts when evaluating healthcare providers. If something feels wrong about how you're being treated, it probably is. You know when you're being treated with respect and when you're not, and you have the right to seek care elsewhere when providers don't meet appropriate professional standards. Remember that finding the right healthcare providers is an investment in your long-term health and well-being. The time and effort you spend finding providers who treat you appropriately will pay off in better health outcomes, more satisfying healthcare experiences, and greater peace of mind about your medical care. You deserve healthcare providers who see you as a whole person with valuable experience and insights, not just as an old person with predictable problems. When providers treat you with the respect and competence you deserve, healthcare becomes a partnership that supports your health goals and maintains your quality of life. If this information has helped you recognize warning signs of inappropriate healthcare and empowered you to seek better medical care, please give this video a thumbs up and subscribe for more content about advocating for yourself and getting the respect you deserve as you age. Have you encountered any of these problematic questions or attitudes from healthcare providers? What strategies have you found helpful for finding respectful medical care? Share your experiences in the comments below. Your insights could help other women navigate similar healthcare challenges. And if you're interested in more content about protecting your rights and dignity as you age, be sure to check out our video about how to communicate effectively with healthcare providers to get the care you deserve. Remember, you have the right to respectful, competent medical care at every age, and you should never accept less than you deserve.